Hello and welcome to the latest edition of Let's Talk Technique from the Virtual Life Surgical Academy. Today we'll be talking about selecting surgical needles for suturing. A suture needle comprises the point, body and swage. Needles come in a range of shapes, sizes and types, defined by their point geometry. The characteristics of a needle can always be identified on suture packaging. Needle types broadly consist of round-bodied and cutting types. Round-bodied needles are designed to separate tissue fibres rather than cut and are typically used for soft tissue, cardiovascular and intestinal suture. Cutting needles are reserved for tough tissue and bone and can be classified by their cutting edges into conventional cutting. In this instance, the needle body is triangular and has a sharpened cutting edge on the inside curve. Reverse cutting, here the cutting edge is on the outside. The needle is particularly resistant to bending and reduces the tendency for the suture to be pulled through the tissue. The trocar point needle, here the needle body is round and tapered but ends in a small triangular cutting point. This needle has a strong cutting head and ensures powerful penetration when in dense tissue. Lastly, the taper cut. The needle body is round and tapers smoothly to a point. This needle combines initial penetration of a cutting needle with the characteristics of a round-bodied needle. For friable tissues and in instances where the potential for a needle stick injury, blunt needle tips exist. Needles can be straight or curved. For most applications, curved suture needles are used. The curve of the needle is governed by the accessibility of the tissue to be sutured. The more confined the operative site, the greater the curvature required. Our top tip when handling needles is to avoid handling the needle at the tip and the swage of the needle holder. Handling it here risks blunting the needle and loosening the suture thread from the swage. Check out our reel demonstrating some common needle types. As ever, we look forward to hearing your thoughts and experiences. Drop a comment in the comment section.